Hello, I'm Dr. Rajesh Kesari, your diabetes specialist. Today we are going to talk about diabetes, few words about diabetes, what is it and what can we do to have a better life even if we have it. First of all, let us understand diabetes is a chronic lifestyle disease. If it is there, it is there for the whole life and it doesn't go away. There's a lot you can do about diabetes. First of all, you have to understand what is diabetes. Why do we need to treat diabetes and what can we do about it ourselves even without a doctor's help if we have diabetes? So, diabetes is a chronic lifestyle disease. It is caused by the increasing insulin resistance or the relative lack of insulin. Insulin is a hormone produced by your pancreas. It decreases the amount of sugar in your blood. Whenever you eat anything, especially carbohydrate like roti, rice, even namkeen, bread, all this contains some glucose. The carbohydrates contained in these foods are converted to glucose, and the level of glucose rises in your blood after having food. And with the help of insulin, this level of glucose is normalized. What happens in diabetes is that this insulin is not produced in sufficient quantities, so that the sugar level is always high in the blood. So what happens is that this high level of sugar in the blood causes lots of complications. That's why diabetes is called a silent killer disease. It's something like it crawls like a snake behind you and it suddenly bites. You don't have any problems, you don't feel anything, but what you feel, what you suffer from is the complications of diabetes. The worst complications are heart attack, stroke, kidney disease, kidney failure, diabetic retinopathy, which can lead to blindness, diabetic neuropathy, in which initially there's numbness, tingling, burning. Later on, it can lead to some infections in the feet, and which may even cause amputation of the foot. So, these are complications of diabetes, and if the sugar is not controlled, they are bound to happen. They are bound to happen. But you can prevent them from happening. How can you prevent them from happening? You can do a lot yourself. Diabetes cannot be treated just by taking pills, medicines, or injections. There's a lot that you can do yourself to help yourself to treat diabetes, to prevent diabetes, and even if you have developed diabetes, to normalize your sugar levels to live a good, healthy, and happy life. Now, in short, I'll tell you what you can do. First of all, modify your lifestyle. Start with your diet. So there's some very simple things that you can do with your diet. First of all, eat a lot of greens. Every green vegetable you see you can have. You can literally have it as much as you want. Eat more of uncooked, fresh vegetables, salads, as much as you want, as you can have. There's no limitation of it. Eat lots of grains, whole grains, food which has a lot of fiber in it that delays the absorption of glucose and delays the rise in glucose. You eat fruits. It is very important to eat fruits also. And the other important thing is a very active lifestyle. So walk, and walk. Try to find every opportunity where you can walk, you can do some exercise, you can be physically active, be it climbing upstairs, be it going to the market, be it parking your car a little bit farther away, be it getting down one metro station earlier. So try to find every opportunity in your life where you can walk, where you can exercise, where there can be an increased physical activity in your life. All this together, your diet and your lifestyle changes like your exercise can do a lot in bringing down your sugar levels and preventing the complications of diabetes. So this is very important. If you have diabetes, you must follow this. Other thing is there are some myths about diabetes which you should do away with. If you start a medicine for diabetes, it's not that if you start it, you'll have to take it lifelong because you started it. Now you start a medicine because you can't do without it. So if a doctor has prescribed some medication, you must take it. If you have to stop it, if you have to change it, if you're having some problems because of the medications, you must consult a diabetologist, a diabetes specialist who will guide you and who will tell you appropriately what is to be taken and what is to be done about it. Now, diabetes patient needs constant monitoring Don't do this mistake of continuously taking the same medicines over a long period of time without consulting your doctor, because with some time the medicine may stop being effective. So, how would you know whether it's working or not? For that, you need to consult your doctor, you need to do regular testing. You must do some basic simple tests like HbA1c, urine microalbumin, at least once in 3 months to know that your sugar levels are under control. At least once a year, you must do some tests like lipid profile, kidney and liver tests, and urine tests, and other tests. And you should also monitor with your own glucometer at home from time to time your diabetes, your sugar levels. And there's some other myths also. People are very afraid of taking insulin. No, if your doctor prescribes or suggests that you require insulin, you must take insulin. Insulin is a diabetic's best friend. The whole problem in diabetes is because you don't have sufficient insulin. So if insulin is required, you must take it. Take care of weight. Just by decreasing weight, lots of medicines can be stopped, diabetes can be controlled, blood pressure can be controlled, and cholesterol levels can be controlled. So these are small, small things. If you incorporate in your life, if you change some of your habits, if you control your diet, if you be physically active, take your medicines regularly, you can have a very happy and healthy life. And for any problems that you have despite all this, we doctors, diabetologists are here. I am here to help you. Thank you.